Welcome to the deep dive. Today, we're tackling a topic that, well, I know can be incredibly frustrating for cat owners.
Oh, definitely.
When your feline friend decides the litter box isn't the only acceptable bathroom in the house.
Uh,
Yeah, we're talking about house soiling and marking.
it's a behavior that can really strain the bond we have with our cats.
It really can.
And sadly, it's actually a major reason why cats end up being rehomed or even relinquished to shelters.
Exactly. So our mission today is pretty simple. We've gone through a lot of expert veterinary advice to, pull out the key insights.
Yeah, trying to get to the bottom of it.
Right. Why does this happen? And probably most importantly for listeners, what can you actually do about it?
Think of it as a shortcut to understanding this really challenging part of living with cats.
Okay, so let's start with the basics. House soiling, what is it exactly?
It's pretty straightforward, really. It
Yeah.
just means a cat is depositing urine or feces somewhere other than their litter box.
Okay, but we need to break that down right away,
Right.
yeah, because it's not just where they go.
No, absolutely not.
It's also how and why. So we need to differentiate between urine house soiling and urine marking.
Precisely. Urine house soiling, or periuria, as it's technically called, is when a cat urinates inappropriately, usually on horizontal surfaces, like a puddle on the floor.
Right. A toileting issue, just in the wrong place.
Exactly. Now, urine marking is different. It's much more of a communication thing. Cats spray a small amount of urine, often on vertical surfaces, and they have this very characteristic posture, tail up, sometimes quivering.
So puddle on the rug, probably house soiling. Spray on the curtains, that's more like a feline bulletin board.
That's a good way to put it, yeah. And we see similar distinctions when it comes to feces.
Okay, tell us about that.
So inappropriate defecation is basically the same idea as inappropriate urination. The cat is pooping outside the litter box as a toileting behavior.
Just needing to go, but not in the right spot.
Right. Then there's fecal marking, sometimes called middening. This is much less common.
Middening, oh.
Yeah. And it involves the cat leaving feces in really obvious, prominent locations, almost like leaving a signal or a message.
What's really interesting here is you said marking is actually a normal way for cats to communicate.
It is. From the cat's perspective, it's perfectly normal behavior.
So even though it might drive us absolutely nuts, they're not doing it to be spiteful or bad.
That's such a crucial point.
Oh.
It serves a purpose in their world. But of course, when that normal behavior happens inside our homes,
That's when it becomes a problem for us.
a big problem. It really can damage that human-animal bond we cherish.
Okay, so we've got a clearer picture of what it is. Now, let's really dig into the why. What's going on biologically or behaviorally?
Well, for inappropriate urination or defecation, it often boils down to a few things.
Yeah.
First, the cat might just be unhappy with the litter box situation.
Like what specifically?
Maybe it's not clean enough for their liking. Maybe they don't like the texture or smell of the litter. Maybe the location feels unsafe or exposed.
Okay, so comfort and preference.
Yeah.
Makes sense.
Or they might have just developed a preference for a different spot or a different surface. Carpet feels nice, maybe?
Maybe too nice. But you also mentioned medical issues can be a big factor.
Absolutely. And this is really critical. An underlying medical condition can create a negative association with the litter box.
How so?
Well, imagine a cat has a urinary tract infection.
Right.
It hurts when they pee. They might start associating that pain with the litter box itself.
So they avoid the box because they think the box is causing the pain.
Exactly. Or maybe they have arthritis and it's physically painful to climb into a high-sided box, so they look for an easier place to go.
That's a really important insight. It's not always just behavioral. You have to rule out medical causes first.
Always. Assuming it's behavioral without checking could mean delaying treatment for something serious.
Okay. What about urine marking specifically? What's the underlying drive there?
Urine marking, like we said, is normal communication. There's a lot of individual variations. Some cats just mark more than others. But generally, the more cats you have in one area, think a multi-cat home or even outdoor cats nearby, the higher the probability of marking.
So it's often related to social density.
Very much so. And interestingly, cats that urine mark indoors often still use their litter box perfectly fine for, their regular toileting needs.
So marking is more about sending signals, maybe due to stress or other cats, while inappropriate elimination is more about the act of toiling itself or avoiding discomfort.
That's a pretty good summary, yeah.
Yeah.
And fecal marking, middening, that's usually a diagnosis of exclusion. It's quite rare.
Got it.
But the common thread, especially for marking, is often social or environmental stress. That's a huge trigger.
This really does sound like a major headache for cat owners. Just how common is this problem? What are we looking at in terms of scope?
It's unfortunately incredibly common. It's actually the #1 behavioral problem that leads cat owners to seek veterinary advice.
Wow, number one.
Yeah. And even more sobering, it's the second most common reason cats get relinquished to animal shelters.
Oh, that's heartbreaking. It really shows the impact. Do we have any specific percentages?
Well, one survey looked at owners who keep their cats indoors. It found about 11% reported issues with inappropriate urination or defecation.
Okay, about 1 in 10.
Yeah. And for urine marking specifically, it's seen in roughly 10% of neutered male cats and about 5% of spayed female cats.
And does where people live matter? Is it more common if cats are indoors all the time?
There's some suggestion it might be more prevalent where cats are primarily kept indoors.
Why would that be?
It could be because they're completely reliant on the litter box provided, and maybe there's more potential for social stress in a confined space compared to cats who can roam outdoors.
Makes sense. Okay, let's talk about who gets affected. Are certain cats more prone to this, like specific breeds, ages, or sexes?
Well, first off, any cat, any breed, can develop house soiling issues. That's important to state.
Okay.
However, some studies have hinted that maybe Persians, Himalayans, and related breeds might pop up a bit more often.
Oh, interesting. Is there a reason for that?
Well, it's not fully clear, but one crucial point for those breeds, if they're showing inappropriate urination, they should definitely be checked for polycystic kidney disease. Get a DNA test.
That's really good specific advice for owners of those cats. What about age? When does this typically start?
Inappropriate urination or defecation can honestly start at any age. Marking behaviors, though, they usually tend to emerge after a cat hits about 6 months old, around sexual maturity.
And does being male or female make a difference?
It can. While general house soiling can happen in any cat, intact or altered, urine marking is definitely more common in male cats.
Even neutered males?
Yes, both intact and neutered males are more likely to mark than females, whether the females are intact or spayed.
Right. Now, shifting gears a bit. If you're an owner facing this, especially in a multi-cat home, figuring out which cat is the culprit can be tricky.
Oh, absolutely.
How do you play detective in your own house?
It's a challenge. Cats can be pretty secretive about it, especially if they've been punished before. Direct observation is ideal, but often not practical.
So what then? Stakeouts.
Huh? Maybe not full stakeouts, but setting up a simple pet camera or even just your phone to record an area can be incredibly helpful. Catch them in the act, so to speak.
Okay, tech to the rescue. Any other methods?
Well, you could try separating the cats temporarily. That might help identify the one doing it.
But I sense a but.
Yeah, the but is that separating them can totally change the social dynamic.
Yeah.
It might even stop the behavior just because the stressor, maybe another cat, is gone. So it's not foolproof.
Right.
There's also a special dye, fluorescein, that vets sometimes use.
Fluorescein dye. Okay, that sounds serious. How does that work?
Basically, if the urine's alkaline, you give the dye to one cat at a time, usually in a capsule.
Okay.
If that cat then urinates outside the box, the spot will glow under a special UV light, a Woods lamp, for about 24 hours.
Like CSI, cat pee.
Kinda. You test one cat. If nothing glows, you move to the next. But there are downsides.
Such as?
Well, you might get a false negative if the cat isn't house soiling frequently when they have the dye. And importantly, the dye can potentially stain carpets or furniture.
Ah, good to know about the staining. Okay, so identifying the cat is one challenge. What about mapping out where the incidents are happening?
That's incredibly useful. I always recommend owners draw a simple map of their home. Mark where all the litter boxes are, and then mark every single spot they find urine or feces outside the box.
And what does that map tell you?
Looking at the pattern can give huge clues. Are the spots near windows? Are they on vertical surfaces? Are they right next to the litter box? It helps figure out if it's marking or inappropriate elimination and what might be triggering it.
So the where tells a story. Let's talk about the when and the history. What can a cat's past behavior or other symptoms tell us? Let's start with inappropriate urination and defecation again.
Yeah, certain things in the history are big red flags for medical issues. If an owner mentions the cat seems incontinent, or is peeing way more often, or has blood in the urine, or is straining to pee.
Those all scream vet visit needed.
Absolutely. Those strongly suggest a medical problem needs urgent attention.
What about on the defecation side? What historical clues point to medical?
If the cat is training to poop, maybe crying out or running away right after, or if the feces are consistently really hard, dry, or bulky.
That suggests pain.
Exactly. Pain associated with defecation. And again, that can lead them to avoid the litter box. Also, look out for broader signs like drinking way more water, loss of appetite, vomiting, or diarrhea. Those often point to underlying systemic illness.
Right, those general not feeling well signs. Okay, what about historical clues more specific to urine marking?
A key one is a history of conflict between cats in the house. One cat blocking another from resources, chasing, aggression, or even just subtle avoidance.
Tension in the ranks.
Precisely. And if an owner has actually seen the cat spraying, that posture is unmistakable. Back to a vertical surface, body stiff, tail up and quivering, small burst of urine backwards.
And the locations of these marks, where do they tend to be?
Often vertical surfaces like walls, furniture legs, sometimes small puddles at the base of walls. Prominent furniture is common, or new things brought into the house, grocery bags, a new chair.
What about like clothes or bedding?
Yes, sometimes marking happens on horizontal surfaces like that. It might be associated with a specific person, or maybe a reaction to visitors or new items carrying unfamiliar scents.
And for the rare fecal marking, middening, what's the historical sign there?
The main thing is the placement. Owners report finding feces left out in really obvious, conspicuous spots, not hidden away at all.
Okay. So after gathering all this history, you get to the physical exam. What does that usually show?
Well, if the issue is purely behavioral, the physical exam itself is likely to be completely normal.
So why do it?
Because it's absolutely essential for ruling out those underlying medical conditions we talked about. Plus, the vet can check for specific things.
Like what?
Like in male cats that are supposedly neutered but are still marking, the vet will check for penile spines.
Penile spine?
Yeah, tiny barbs on the penis that are usually maintained by testosterone. If they're present in a neutered cat, it suggests there might be some remaining testicular tissue or another source of testosterone.
Ah, okay.
They might also measure testosterone levels in the blood in those cases.
Got it. Let's dive deeper now into those potential underlying causes. We've touched on them, but let's really unpack the why, starting with the medical side again. What specific conditions are common culprits?
There's quite a list. Anything metabolic or gastrointestinal that causes increased urination, diarrhea, or constipation can lead to accidents.
Right, if they just can't make it in time or it's uncomfortable.
Exactly. Then there's lower urinary tract disease. This is a big one for inappropriate urination. It includes things like feline idiopathic cystitis or FIC.
FIC?
Yeah, idiopathic cystitis, basically inflammation of the bladder with no obvious cause like infection or stones. And interestingly, FIC itself is often linked to stress.
Stress causing physical bladder problems. Wow.
It's a complex link, yeah.
Oh.
Urinary stones, urolithiasis, are another major medical cause.
Okay, what else?
Systemic diseases like diabetes mellitus, hyperthyroidism, those definitely impact urination, and sometimes defecation. Infectious diseases like FeLV, or FIV, can play a role. Liver disease, even central nervous system problems, or cognitive decline in older cats, like senility.
It really covers a lot of ground medically.
It does. And don't forget, things caused by treatments, iatrogenic factors. Giving fluids, certain drugs like corticosteroids or diuretics, can increase urine output.
Right.
And musculoskeletal pain is huge. Arthritis making it hard to get in the box or squat comfortably. And finally, hormonal imbalances can sometimes influence marking.
So step one always is thorough medical investigation.
Absolutely.
Okay, assuming medical causes are ruled out or are being managed, let's focus on the behavioral side. For inappropriate urination and defecation, what are the big behavioral triggers?
Litter box problems are probably number one on the behavioral list.
We keep coming back to the box.
Because it's so often the issue. Is it scooped daily? Is the box washed regularly? Is there the right number of boxes?
What's the rule again?
Generally 1 box per cat plus 1 extra. So 2 cats need 3 boxes.
Okay. And location matters, too, right?
Hugely. Is it in a noisy laundry room? A busy hallway? Somewhere the cat feels trapped or can be ambushed by another pet or a child? That all makes a box unappealing.
What about the box itself? Covered versus uncovered? Size?
Yes, all important. Some cats hate covered boxes. They can feel trapped, hold odors. Maybe it's just too small for them to turn around comfortably. If another pet can corner them in there, they'll avoid it.
Timing can be a clue, too, you said.
Yeah, if the accidents happen in specific times, like only when the owner's away or only overnight, that might point to an environmental trigger or separation anxiety. But a sudden onset in a previously reliable cot often signals a medical issue or a sudden social change.
And the litter itself, that's got to be a factor.
Oh, big time. Most cats seem to prefer unscented, fine-grained, clumping litter. But individuals vary.
So if you switch litters and the problem starts,
That's a likely suspect. They might just hate the new stuff. And
Yeah.
interestingly, sometimes if a cat suddenly starts peeing on really cool, smooth surfaces like a bathtub or sink,
Yeah.
that can actually be a sign of lower urinary tract discomfort. They might feel better than litter.
Wow. Okay. What else about location?
Well, where they choose to go instead tells you something. Is it just one preferred spot? Maybe that spot is just more appealing for some reason. Or is it near the litter box?
What does near the box suggest?
That often means they want to use the box.
Hmm.
But something about the box is wrong. Maybe it's dirty. Maybe they dislike the litter. Maybe they had a bad experience there. And never underestimate social dynamics, especially if a new cat arrives. Conflict is a major cause.
So many potential litter box landmines. What about the behavioral causes specific to marking?
Marking is tightly linked to the cat's emotional state. Think arousal, anxiety, territorial feelings.
Right.
And like we said, the probability goes way up with the number of cats.
Sure.
More cats often equals more social stress and more marking.
What kind of things trigger it?
Household disruption is a big one. Moving furniture, having guests over, changes in routine. And other cats. Seeing cats outside through a window or door is a classic trigger. That's why marks often appear near those spots.
Even indoor cats reacting to outdoor ones.
Oh, yeah. Also, new objects brought into the home, those grocery bags again. New furniture. They carry unfamiliar smells that can make a cat feel insecure and need to mark their territory.
Okay, so we've got medical causes, litter box issues, social stress, environmental triggers. Are there things that just generally put a cat at higher risk for any of these problems?
Yes, we can identify some risk factors. For inappropriate urination or defecation, definitely poor litter box hygiene is a big one.
Makes sense.
Also, just having undesirable litter box features the wrong type of litter for that cat. Scented litter they hate, a box that's too small, or a style they don't like maybe a covered box.
And for urine marking, what increases the risk there?
Being male is a risk factor. Being sexually intact, not neutered or spayed, is another major one.
Which is why neutering is so often recommended.
Exactly. Living in a multi-cat household significantly increases the risk. And interestingly, there might even be a genetic component. Having a parent cat that was a marker seems to increase the risk too.
Fascinating. Okay, we've explored the what and the why pretty thoroughly. Now let's get into the how do vets actually diagnose what's going on? What's the process?
The absolute non-negotiable first step is differential diagnosis. You have to rule out medical problems before you jump to assuming it's behavioral.
Right, medical first.
Then, if it does seem behavioral, you need to figure out, is this inappropriate urination or defecation, or is it urine marking? Because the approach to treatment will differ.
So what kind of lab tests are standard?
Usually a CBC, complete blood count, a biochemistry profile, and a urinalysis are the starting point.
What do those tell you?
Well, they might be perfectly normal if it's purely behavioral. But the urinalysis is critical, especially for inappropriate urination. And ideally, you want that sample collected via cystocentesis.
Cysto what?
Cystocentesis. It means using a sterile needle to get urine directly from the bladder. It gives a much cleaner, more reliable sample for checking infection or crystals compared to catching pee.
Gotcha. Clean sample is key.
Definitely. Sometimes, if the signs come and go, the vet might need several urine samples over time. And the blood work, the CBC and biochemistry, are good for overall health assessment and essential before starting certain medications.
Are there other tests sometimes needed?
Yeah, for tricky cases or if other signs pop up, testing for things like hyperthyroidism, FALV, or F5V might be recommended.
What about imaging, like x-rays?
Absolutely. Abdominal x-rays or ultrasound, sometimes even contrast studies where they use dye, might be needed to look for things like bladder stones.
So lots of potential medical tests. What else is part of the diagnostic puzzle?
A super detailed history from the owner is vital. We talked about the house map showing elimination spots and box locations.
Right, the detective work.
And that behavioral diary, getting the owner to track every pee and poop inside and outside the box every day. It requires commitment, but it provides invaluable patterns and clues.
And pathologically, like if you did biopsies, usually nothing found.
Generally no specific pathological findings unless there's an underlying medical disease causing the problem.
Okay, so it's a process. Rule out medical, gather detailed history, map it out, track the behavior. Now, the moment everyone's waiting for treatment, what can we actually do? Where do we start?
First things first, treat any underlying medical condition found. That's paramount.
Makes sense.
Then, whether alongside medical treatment or if it's deemed behavioral, the focus really shifts to environmental and behavioral therapies. Medication might come in later or alongside, but environment is key.
What does a supportive indoor environment actually mean in practice?
It means ensuring the cat has plenty of safe, quiet resting places, especially elevated ones. Separating resources, food, water, litter boxes so one cat can't guard everything, and making sure interactions with humans are positive and predictable.
What about immediate steps if a room is getting soiled constantly?
Temporarily restricting access to that room can help break the cycle while you work on the underlying cause. In multi-cat homes with conflict, sometimes temporary confinement when unsupervised, with all resources provided, and then supervised reintroductions can be a short-term measure.
And cleaning.
Yeah.
That's important, right?
Crucial. You absolutely need to use an enzymatic cleaner specifically designed for pet urine and feces. Regular household cleaners often don't break down the odor molecules completely, which can attract the cat back to the same spot.
Got it. Enzymatic cleaners only. Okay, let's zero in on treating inappropriate urination. What are the main environmental fixes?
Litter box hygiene is number 1, 2, and 3. Scoop daily, at least. Wash the box itself regularly with mild soap and water.
No strong chemicals.
Avoid strong odors near the boxes. That includes harsh cleaners, air fresheners, and strongly scented litters. Most cats prefer unscented. Also, move food and water bowls away from the litter boxes. Cats generally don't like to eat near their toilet. And increase the number and distribution of boxes, remember, 1 per cat plus 1, in different quiet locations.
We keep circling back to the box itself. What about type and style?
Yes. If they're using a covered box, offer a large, plain, uncovered alternative. Use that unscented, fine-grained, clumping litter, usually without a liner to start.
Like a litter box buffet.
Exactly. Offer choices and see what they prefer. Keep that log. And if they have a favorite wrong spot, try putting a box right on that spot. Once they use it consistently, you can start moving it maybe an inch a day towards a more acceptable location.
Okay, slow and steady wins the race there. What about specific tactics for urine marking?
Well, if outdoor cats are the trigger, you need to address that. Deterrence, motion-activated sprinklers maybe?
Yeah.
Or blocking the view. Trapping and neutering neighborhood strays can help too.
What about inside the house?
Reducing the number of cats, if that's feasible and the source of conflict, can decrease marking. And then there are pheromones.
Feline.
Yes, synthetic feline facial pheromone products like Feline sprays or diffusers. They can be really helpful, reducing marking in up to 75% of cases in some studies.
That's pretty significant.
It is. And don't forget, good litter box management, all those things we just discussed for inappropriate urination, can also help reduce marking by lowering overall stress. But
yes,
for persistent marking, pharmacotherapy medication often becomes a really important part of the plan.
Right, medication. We'll get deeper into that. Anything else non-medical? Activity, diet?
Activity, yes. Daily interactive play sessions that let the cat mimic hunting, stalking, chasing, pouncing on a toy that can really help burn energy and reduce anxiety.
Good outlet for stress.
Exactly.
Yeah.
Diet-wise, unless there's a specific medical reason like managing urinary crystals or constipation, there isn't one magic diet for house soiling. Just good quality nutrition for overall health.
It sounds like owner education is a huge piece of this puzzle. What are the absolute must-knows for people dealing with this?
Oh, huge. First, cats do not do this out of spite. Punishment is counterproductive.
Say it again?
Punishment increases anxiety, damages your relationship, and can make the problem worse. Don't do it.
Okay. What else?
Focus on understanding the motivation. Why is the cat doing this? Is it medical? Stress? Litter box aversion? You have to figure out the why. Create a predictable environment routine helps reduce anxiety. Address inner cat conflict if you have multiple cats. And meet their basic needs. Exercise, play, safe spots up high.
What about surgery? Spaying, neutering?
Definitely. As we mentioned, castration significantly reduces urine marking in the vast majority of males, up to 90%. And spaying helps in females too, up to 95%. It's often a first-line recommendation if the cat isn't already altered.
Okay, now let's really get into the medication side. When is it brought in and what's used?
For inappropriate urination, meds aren't usually the first step. Maybe considered if environmental changes fail or if there's clear generalized anxiety involved.
More marking.
For urine marking, medication to reduce arousal and anxiety is often necessary for success. Several classes of drugs can work.
Like what?
Things like SSRIs, selective serotonin reuptake inhibitors, or TCAs, tricyclic antidepressants, also izapirones. They all generally aim to lower anxiety levels.
Are there side effects?
There can be, yeah. Usually transient, meaning they don't last long. Things like mild sleepiness, maybe decreased appetite initially, sometimes constipation or mild stomach upset. Usually mild, but something owners need to watch for.
Can you give examples of specific drugs?
Sure. Common ones include fluoxetine, that's Prozac or paroxetine, which are SSRIs. Clomipramine or amitriptyline are examples of TCAs. And buspirone is an azaparone. The vet decides which is best based on the cat and the situation.
Are drugs used for fecal marking too?
Potentially, yes. If it seems driven by anxiety or high arousal, similar medications might be tried to help reduce that underlying emotional state.
Are there times when these drugs absolutely shouldn't be used? Contraindications?
Yes, definitely. For instance, benzodiazepines like diazepam carry risk, albeit rare, of fatal liver failure in cats, so they're generally avoided now.
Okay, good to know.
TCAs need caution in cats with heart conditions, certain urinary or digestive issues like blockage risk or megacolon, seizure history, or glaucoma. Also, putting these meds in transdermal gels for the skin hasn't proven reliably effective.
And these are off-label uses, right?
That's a critical point. All these psychotropic drugs are used extra-label or off-label in cats. Vets must inform owners, discuss potential side effects thoroughly, and document everything. It's best to start meds when the owner can monitor the cat closely for the first few days.
Any interactions to worry about?
Yes. For example, you absolutely cannot combine MAOIs with TCAs or SSRIs. Serious reactions can occur. The vet needs a full list of everything the cat takes.
Are there any alternatives? Less common drugs or supplements?
Synthetic progestins used to be used, but serious side effects make them much less common now. Pheromone therapy, Feline, is a great non-drug option, and some supplements like L-theanine or alpha-casozepine might help reduce anxiety in some cats.
Okay, so treatment is started, environment changed, maybe meds on board. What about follow-up? How do you track progress?
Regular follow-up is crucial, and that daily log the owner keeps, it becomes essential.
The elimination diary.
Exactly. Counting the P's and poofs inside and outside each numbered box tells us if things are improving. Based on that log, the vet can adjust medication dosage or other therapies.
How long do cats typically stay on meds for marking?
If a cat's been doing really well for, say, 2 months, and the underlying stressors, like maybe the conflict with another cat, have been resolved, the vet might try a very gradual withdrawal over a couple of weeks.
But if the stress are still there?
Then long-term medication might be needed to keep the marking under control. And for cats on long-term meds, annual checkups with blood work and urinalysis are recommended just to monitor their health.
Makes sense. Finally, looking ahead, prevention, what can owners do proactively, and what's the general outlook, the prognosis?
Prevention starts with the basics. Neuter your cats. Manage the number of cats to minimize social stress. Educate owners from day one about good litter box practices, number, type, size, location, hygiene.
Vets play a role too.
Big time. Vets should ask about house soiling at every visit. Catching it early makes treatment much more likely to succeed.
What should owners expect during treatment? Is it a quick fix?
Almost never a quick fix, especially for long-standing problems. Setting realistic expectations is key. Aim for gradual improvement, not overnight miracles.
And the overall prognosis, can these issues be resolved?
The prognosis is generally good if the underlying cause is found and managed properly, whether it's treating a UTI, improving the litter box setup, reducing stress, or using medication appropriately.
But if it's not treated?
That's where the sad outcomes happen. Untreated house soiling can destroy property, severely damage the human-animal bond, and ultimately lead to cats being abandoned, relinquished, or euthanized. It's serious.
Wow. This has been a really, really thorough deep dive. It's clear that house soiling and marking are complex, not simple at all.
Not at all. So many potential factors: medical, environmental, social, behavioral.
And the key takeaway seems to be understanding those nuances, ruling things out methodically, and working closely with your vet.
Absolutely.
Yeah.
There's no one-size-fits-all answer.
Yeah.
It has to be tailored to the individual cat and their specific situation.
Right. And maybe a final thought for everyone listening. Given how strongly stress seems linked to these behaviors,
Yeah.
what subtle things in our homes, things we might not even notice, could be impacting our cat's stress levels and how they're trying to communicate with us. Something to really ponder.
Definitely food for thought.
Thank you so much for sharing all this insight, and thank you for joining us for this deep dive.